Gold participants and listeners from around the world. I'm Kristen Schwartz, licensed midwife and MC for Gold Learning. Here at Gold, we love to connect with experts in the maternal child health field. And one of these experts is sitting here with me today for a little chat for our podcast. I have the great pleasure of having today with me Dr. Ibone Olza. Welcome.
Hello, Christine. Hello, everyone. Thank you.
It's wonderful having you here, and you will be part of the Gold Perinatal Online Conference in 2019, isn't that correct?
Yes, thank you. It's quite an honor. I'm very happy to be here with you today.
And we are very happy that you can make it. First of all, speaking with me today, and then next month for the conference as well. And you will be presenting on the psychological experience of physiological childbirth, and we'll dig into that just a little bit. But before we talk about the conference and your presentation, I want to ask you, where in the world are you located? We have an international audience, so everybody is always interested where our speakers are coming from.
I come from Spain and I currently live in Madrid.
Very nice. Well, thank you for sharing that. So, let us know a little bit about yourself. What is your background?
Well, I'm a medical doctor, and as soon as I finished medicine, I started my training in psychiatry because I wanted to be a child psychiatrist. And the same time I was going through my training, I became a mother. I'm a mother of 3 grown-ups now. And in fact, when I had my first child, I knew nothing about breastfeeding, but I was very lucky that in the town where I was living in Zaragoza is the hometown of Spain's oldest breastfeeding support group, Via Lactea, Milky Way. So that's how I started to learn. In fact, I realized soon that as a medical doctor, I knew nothing about breastfeeding. And I was very lucky. These mothers helped me so much with my 3 babies and with my breastfeeding experiences, which totally changed the way I view it. So I started learning. I started to become very passionate about it. And also as a child psychiatrist, I started to look at it from the other perspective. At that time in Spain, we had a big problem with the way birth was handled. And many women and many children would suffer the very bad consequences, I would say, from traumatic births, same as I had had with my own birthing experiences. So I soon became an activist. It was nothing that I really chose. It was more something that happened because as I learned more, I understood more about breastfeeding and about childbirth. It became a necessity for me to do as much as I could to help the change take place, the change I wanted to see. So I became an activist. We started a consumers group in Spain back in 2003 called Childbirth is Ours, in Spanish El Parto es Nuestro. And I started to join many other women, mothers, help them heal. We also become very involved with many professionals, midwives, obstetricians, who also wanted to change things and make them better. So it has been like a collective movement here in Spain. And within that movement, I also started to work more and more as a psychiatrist with the breastfeeding moms, with infants. So I ended up kind of specializing in perinatal psychiatry, which I hadn't thought would happen, but it ended up happening. And then after listening to so many women, I kind of started to research around childbirth. So it's all been a long, I don't know, it became my passion in life and also my professional development. But it happened a bit like this, a bit unexpected as things happen in life usually.
Right.
So it's a long story. I don't know if it came out clear, but
Absolutely, absolutely. And I love listening to you because how you describe how you started off your journey as, first of all, after, when you had your own child, realizing as a professional, as a doctor, not knowing that much about breastfeeding. And did that come as a surprise to you?
yeah,
As a,
yeah. I think I had to unlearn a lot, and I think that
right.
happens to many doctors, and that has been my path. I've had to unlearn because I think medicine comes from like a misogynist tradition, and
Mm,
so women have not traditionally been listened to by
Right.
doctors, mothers especially. So it's been very interesting for me to realize how much I had to learn from mothers and as a mother. And then I took that back to medicine.
That is interesting, and I'm glad you're taking it back to medicine. That's I also enjoy hearing about your journey. As you said, you started this, it's almost like a grassroots organization with other professionals, mothers, other healthcare professionals, learning from other mothers and so on. So when you started out, was there, I mean, you mentioned the oldest breastfeeding
Mm-hmm.
association there in Spain. I love the name Milky Way. But
Yeah, that's good.
were there a lot of resources out there, or was it something you kind of you felt like you and the mothers were basically on your own and you kind of created that? How was that, and how do you see it now? Have th
Yeah.
things changed a
Well,
lot?
I think, yeah, things have changed a lot. We started almost at the same time the internet and the email
Mm,
groups started, and that helped us a lot. When I was trying to have my vaginal birth after 2 cesareans for my third birth, I joined ICANN, American Cesarean Support Group. That was very helpful.
hmm.
And so we decided to start something similar. It was very much inspired by ICANN, what we started in Spain. It was a cesarean support group for women who had traumatic cesareans or who
Great.
wanted to avoid cesareans. The thing is that soon many women joined our group who didn't have cesareans. They had vaginal births, but very traumatic. And we also
Mm,
had many professionals who joined who were not happy by the way they were working with
right.
childbirth. So that's how we started this movement, and things have changed a lot. It's been nice. I'm happy. I mean, I know there's a lot that still needs to be changed, but I think now there are a lot more resources. Also, as a psychiatrist, what happened to me was that I would go to these breastfeeding support groups. I would go as a mother, but
Hmm.
once other mothers, and I wouldn't even introduce myself as a psychiatrist because I felt I knew nothing as a doctor about breastfeeding. But as years went by, more and more women would come to me saying that their doctors had told them to stop breastfeeding for non-good reasons. They would tell me, this doctor has told me to I quit breastfeeding my 3 months old baby to take this medication for anxiety or depression. And that would upset me so much because I knew those were not good reasons to tell a woman to breastfeed, to stop breastfeeding. So I started to research on that. And of course, I ended up treating mothers who would look for me, and so that forced me to study more and more and learn more. And then that's when I joined Marseille Society, and that has been a big inspiration also, I would say, for me. ICANN and Marseille Society have helped us a lot here in Spain, and now fortunately we have a lot more resources. That's a good thing. And
Tell
many
us
more
about the
professionals.
Yes, tell us about the Marseille Society. Maybe some of our listeners might not be familiar with that.
Marseille Society is an international network of perinatal mental health professionals who are developing programs and research and sensitization to treat maternal mental problems during pregnancy and postpartum, and
Hmm.
also including their partners and their infants. So it's a very nice society because it's very multidisciplinary, and there are many good professionals from all around the world in Marseille Society, and for me it's where I have learned a lot from them too. Yeah, and we started a group in Spain also, Marseille, Spanish Marseille Society.
Thank you for sharing that. That was insightful too. Yes, and you mentioned a very important thing there. That more and more, some women came to you, talked to you about how traumatic their birth was, or their experience was, or they were told to stop breastfeeding because
Hmm.
of a certain medication. And that's where you came in as a psychiatrist. Now we start learning more and more about trauma and birth trauma. And traumatic experiences or C-section trauma. Tell me what you see the trend now. I'm sure this is something that we recently see in the last few years, right? I mean, there was a time when women didn't talk so much about it because they were told, "Oh, you had baby is alive, you are alive. What else do you want?" Right? So now we're focusing more on this. What do you see lately in this area?
Well, we're happy to see like a kind of like a Me Too movement around
Mm,
childbirth. for many years, starting from my own experiences that were, for me, I had very traumatic cesareans. And I
Mm.
think two of them were probably unnecessary. So for me, it was very painful as a mother and also as a medical doctor to realize that how much harm was being caused to mothers and infants in hospitals during childbirth. And for me, this is still very painful. I'm not talking about myself. I'm talking about all the mothers that I've seen, okay, and all the
Yeah.
infants. So when we started to work about this, as you said, many people would say, "What are you complaining about? You have a healthy
Hmm.
baby." But as a psychiatrist, I realized many of these mothers had very severe post-traumatic stress disorders that would go untreated and undiagnosed, and that this was not taken into account seriously. And I think thanks to the strong work of many activists, and I will include myself among those, but I think this has been a huge effort done by many, many people around the world. Now it's been acknowledged. The World
Hmm.
Health Organization published back in 2014 the first document denouncing the abuse and mistreatment during childbirth. Even before that, in some South American countries, they started to legislate on the concept of obstetric violence. And
Hmm.
the past weeks, I've been very, very happy to see the report from the United Nations. They have published this July a special report on the mistreatment of women during childbirth. And they have described the dimension of the problem, how this is a form of gender violence, and how important it is to name it so we can start eradicating it. So I think we have we have good news, you know. I think the world is becoming now aware that we cannot keep on treating women and their newborns this way, you know. The change has to be very, very big. And it's very important also for me, it's very important to acknowledge the suffering of many professionals. Many midwives, many obstetricians do suffer because they do feel accomplice and they do not want to cause this harm. And they have huge conflicts and they do suffer. Many of them have burnout or they quit their hospital work or they change even professions. So I think it's very important to take into account that this violence affects everyone, not only the women, of course, but also their partners, their babies, and also the professionals. And I think right now there's starting to be like a global awareness of this. So I'm happy that we are seeing this awareness rising.
Wonderful. And Ibone, you were right on the forefront on all this, and you're doing so much, and you're out there, and then you even have written 5 books. How do you do this all? My goodness, that's just absolutely amazing. Tell us a little about the books you have written.
Okay. Well, the thing is, I'm passionate about it. And the
I
more
can
I
hear
learn
that.
about childbirth and breastfeeding, the more it fascinates me because there's so much to learn, you know, from women's stories about childbirth. So yeah, the first book I published came out in, I think it was 2005, and it was the first book in Spanish about cesareans. It was called
Mm.
Nacer por cesárea, it's birth by cesarean, and the subtitle was Avoiding unnecessary cesareans and having respectful cesareans. I wrote that book with an obstetrician, and I think it's still selling a lot all through South America. It was also translated to Italian and Portuguese, and I think it was the first book in Spanish to
Mm.
name the emotional wound that many cesareans live. And I still get many emails from mothers who thank us for that book. And then I did write some other books more about breastfeeding. I wrote this one that was called Lactivist.
Mm.
And it's because I keep this blog and I write a lot about breastfeeding, so I have many interesting exchanges with the people who follow my blog, and many of them
Amazing.
share very interesting experiences breastfeeding. There's so much to learn about breastfeeding that is not in the books yet. You know, it's not even in the agenda. Sometimes women tell me stories, you know, and I'm always learning. So that's why I wrote these books. And I also wrote a children's book. It's called Hermanos de Leche, which is like milk siblings. It's a story. It came out from a story that happened to my daughter when I was breastfeeding her, and she was like 4 years old in school, and she told everybody she was still being breastfed, and all the other children made fun of her, and nobody believed her. So I had to go and talk to the teacher the day after, and we ended up giving a lesson in the school for the children about breastfeeding. It was very nice, but
Oh,
that came
wonderful.
out as a book. And then my last book is called Parir, which is to give birth. It's about the power of childbirth, and it kind of summarizes my perspective now in childbirth, because I have been the past years I've been integrating all these parts, and I think what we are coming out now is a new different look of childbirth as a especially a neuropsychological event, and it's very profound when we understand childbirth as a neurohormonal event, and then we understand the psychological experience that I will talk about during my talk. It kind
Mhm.
of it makes a lot more sense, and it makes us understand the richness of the experience, and how empowering a good birth can be. So that was my last book, and now I'm doing this research with this European funded research. So we are a network of researchers from all of European countries, many midwives and psychologists, and it's a lot of fun. So we've been doing research on this topic for the past 4 or 5 years, I would say.
How wonderful. And thank you for sharing that with us. And it's a perfect transition to the presentation you're giving too. So the psychological experience of physiological childbirth. Tell us a little bit about that.
Well, as I say, as a psychiatrist, I started to change my perspective of childbirth. When we understand childbirth is directed by neurohormones produced in both the maternal and the fetal brain, then it changes our perspective. And the next question is, if these neurohormonal processes do happen in all labors, can we expect all women giving birth having or undergoing through some kind of similar psychological process? Is there a common experience that we can expect any woman giving birth today around the world to go through something similar, independently of her culture or her background? So we asked that question, we researched it, and that's what I will be talking about.
Wonderful. I can't wait for your presentation, Ibone. It was,
Thank you.
and it has been an absolute pleasure having you here and talking with you today.
Thank you. I love the topic, so I very much enjoy this invitation. Thank you so much for it, Christine.
And this is now for our listeners here. This presentation will be live on October 21st. And as I mentioned before, it is part of the Gold Perinatal Online Conference of 2019. For more information on this presentation and all the other presentations in the conference, please visit our website. Go to goldperinatal.com. You'll find over 14 hours of education by international speakers here. So we hope to see you there in October for the Gold Perinatal Online Conference of 2019. Bye bye, everyone.